Despite Obamacare, they're still with us, and especially in a rural, isolated, poor area like Lewis County. And it breaks my heart when I have to deal with uninsured people. People are so poorly insured that they have to make, painful rationing decisions about what they're going to spend their money on, decisions which are destructive to their health. I am reminded of a young diabetic boy. I apologize, he's not a boy anymore, he's a man, but I knew him since I diagnosed him with diabetes at the age of 4. And for a long time, he had no insurance and no money, and he scraped by with donations of free insulin that I would give him from my office and whatever care I could offer him in my office for free, because he had no money and he was too proud to apply for Medicaid. He was a farmer, a very independent fellow. But he never saw ophthalmologists. He never did lab work. He rarely saw me officially, except for what he could get for free from my office. And he thinks that I saved his life because I got him the medicine he needed to stay alive, and I probably did save his life. But at this point, he's in his mid-20s, and he's almost blind from his diabetes. He's not one of those deaths that we were talking about earlier. But my God, what a cost. This is a crime. This is a scandal that we as a society have failed to put him in a position where he could save his eyesight. I'm ashamed of that. And there are a lot of uninsured people like that. And it used to be when I ran my own practice that I could offer tremendous discounts to these folks. Again, I'm reminded of a guy who I take care of who was a self-insured, self-employed carpenter. Good, honest, honorable man, proud and decent, who had a heart attack and an upper GI bleed in rapid succession. And he racked up a lot of bills with me and a lot of bills with the hospital and the cardiologists, and but he had no money. And the deal I ended up making with him is that I forgave him all of my hospital bills because he had a really valuable asset. He had a brother-in-law who ran a sawmill and who got me some spectacularly curly maple that fresh off the saw. And when I work with that down in my shop, it's a pleasure, not only because the lumber is so beautiful, but because the story that goes with it. But that's sort of like saying you're going to pay your doctor in chickens. That's not the way you finance your healthcare system. While it's true that Obamacare has gone a long way to repair some of these aspects of our ailing system, it's really not adequate. A single-payer system would go a long way towards eliminating these sorts of problems. These sorts of problems with people with preventable illness, like this guy with a heart attack, who should have been on statins years ago but wasn't. This guy with diabetes who just needed basic care. We should be doing a much better job for these folks. We can save their vision. We can save their hearts. And we'll be able to recoup a lot of these costs by eliminating the long-term damage down the road when it's a lot more expensive. I would say, bring it on. Bring on your universal system. I think it's really important.